Hello everyone, we are from small group discussion B2 are going to present our student project with the title Identification of Intravital Wounds. Here are our group members. My name is Anggia Mandatrian Devi with last 3 digit of student ID number R088. I would like to explain about the introduction. The first one is the background. Determination of injury that caused death and the intravital wounds is important in the reconstruction and identification of suspect. Evaluation of wound age relates to how long the individual has survived after the injury. Meanwhile, demonstration of lesion vitality refers to identifying whether the injury occurred antemortem, perimortem, or postmortem. Immediately following an injury, there is usually a complex combination of events that must be considered in order to obtain convincing evidence to determine the occurrence of the injury. Acute inflammation, hemorrhage, proliferation, and remodeling are the several processes that make up this complex chain of occurrence. So, how do we assess the wounds to get the information we need? Skin lesion may show the vitality of the bruise if there is macroscopic blood penetration of the soft tissue, whereas discoloration may suggest survival time. However, examination of the wound by the naked eye is clearly not a reliable method of proving the vitality of the lesion. Histological analysis and other stains can assist in visualizing intravital signs in human tissue. Due to the importance of intravital signs of injury and their influence on reconstruction and judicial decision, we are interested in discussing this topic in our student project. That's all from me. Next.
All right, good morning, doctors and friends. My name is Sen Aurelia Ahmad, and now I will continue from the backgrounds. Now we'll discuss about the problem formulation, objectives, and benefits. So in problem formulations and objectives, we'll discuss about the definition, types and classification, histological comparison, its clinical methods, and its practical appliances of identification of intravital wounds. Next, for the benefits of the student project, by studying and creating the student project, we'll gain knowledge about determining the intravital wounds, and also this will increase the knowledge of healthcare practices for the daily life in the workplace context. Maybe that's it for me. The next presentation will be continued by my friend. Thank you.
Hello everyone, my name is Putala Yudhantara with my last 3-digit ID number is 173. In this session, I will try to explain about chapter 2 about content. Next. Okay, first of all is definition of intravital wounds. Intravital or antemortem wound is a wound that appears or occurs before death and usually can be seen from signs of healing at the wound site. Antemortem wounds are something that contribute greatly for forensic pathologists. Why? Because intravital wounds can be easily identified throughout the healing of the wound site. Intravital injuries can be identified macroscopically or microscopically by histopathology, immunohistochemistry, and enzymology technique. And also, intravital on antemortem wounds can be also supported by antemortem data that can be concluded from physical data that owned by the victim while the victim was still alive. Okay, that's all from me, and the presentation will be continued by my friend. Thank you.
Hello, my name is Putu Syarita Indi Pratiwi, student number of 221. Today we'll be talking about the types of intravital wounds. The first one is blunt injuries, injuries that are caused by the applications of mechanical force to the body by blunt violence, where the skin cannot be penetrated by the objects. Types of blunt injuries, the first one is abrasions, an injury to the surface of the skin in which the superficial layers of the skin are removed by frictions against a rough surface. The second one is contusions, capillary damage under the skin without causing significant skin damage, so that the blood will come out of the blood vessels and gather in the interstitial tissues. The third one is lacerations, formed when an object strikes or tears the body with energy exceeding the capacity of the elasticity of the skin and underlying tissues. The types of intravital wounds, the second one is sharp injuries, injuries that are caused by cut, incisions, or puncture in the skin by a sharp instrument. The first one is incised wound, occurs when the sharp eyes of the weapon pointed parallel to the surface of the body and moved horizontally. Second one is stab wound, caused by sharp violence using things that has a sharp tip, like scissors or spear, done by stabbing and can cause damage to the internal organs. The third one is chop wound, caused by heavy weapon that has a sharp edge like sword or axe, followed by swinging with a great force and causing severe tissue damage and damage to the underlying bones. Next.
Hello, my name is Igrio Rakatamanginata with 3 digit student education number 061. This presentation I will continue about types of intravital wound. Next is gunshot wound. Gunshot wounds are often known as ballistic trauma, injury to the body due to penetrating effect of the projectile or bullet from firearms. This can classify into several characteristics. Number one is entrance wound. Entrance wound is the wound that produced when the bullet enters the body. Exit wound is produced by bullet that penetrating throughout the body, complete or incompletely. Hard contact wound when there is a sign by smoke to the muzzle of firearms. Distant wound when there is central perforation with marginal abrasion. And last is shotgun wound characterized by central perforation with satellite pellets. Okay, that is all for my presentation. Thank you.
Hello, my name is Justin Lordialin. I'm going to continue our presentation about histological features of intravital wound. The results of a study conducted in Brazil and published in the journal Histological Analysis of Short-Term Vital Reaction in Skin Wounds, potential application in forensic work show a difference in histological features between rats injured at 3 different time intervals, 15, 30, and 60 minutes, and non-injured rats. The results show that the fibrin accumulation at the borders of the incision appears stained in red by Mallory's trichum stain mixture in the segment representing the 30 minutes reaction time. However, there is no fibrin accumulation found in the borders of the incision inflicted after death, where the entire tissue appears stained in blue. Segment collected from rats subjected to a 15 minutes vital response show the buildup of fibrin at the wound margins, which is colored red by Mallory's trichum. The skin segment shows a higher buildup of fibrin along the boundaries of the incisions in the 60-minute response time, which is more visible than in the 15 minutes reaction period, as shown by a stronger stain and expanded region. Next.
Hello, my name is Sangayu Putu Damagita Laverdesuri with last 3 digit number is 036. So I would like to explain about the histological features of perimortem wound. Basically, perimortem is a period at or near the time of death. It means that perimortem wound is a one that caused by an injury that happened around the time of death. Other sources also mention that a wound is defined as a perimortem wound if the injury happens when the victim's brain is already dead, which caused the decreasing of blood supply to the tissue, but before postmortem changes appeared. Unfortunately, a more specific discussion regarding to the perimortem time limit and also perimortem wound feature is still unclear. Based on histological examination, usually perimortem wound will show mild to moderate bleeding as well to mild to moderate inflammatory cell debris. This is compared to intravital and also post-mortem wounds. Thank you.
Hello everyone, my name is Yosefina Grasletaji with last 3 digits to the ID number 087, and I will going to explain about histological feature of postmortem wound. In a study to differentiate antemortem, perimortem, and postmortem wound on fractured rats, the hemorrhage was absent in postmortem fracture. Fracture induced 2 hours after death were observed microscopically 3 days of section and 6 days of section. Histological findings at 3 days of section show autolytic change of osteocyte and empty lacuna, numerous both osteocyte and marrow nuclei in the bone tissue section, and there was slight marrow dehydration, and also absence of hemosiderin particles between bone fragments, and no hemorrhagic spot were seen. At 6 days after resection, histological findings showed complete damage of bone tissues, disappearance of both some osteocytes and their lacuna, decreased both osteocyte and marrow nuclei were refilled, And in addition, mild dehydration and no hemosiderin particles or hemorrhage was detected. And in another study assessing wound histology, the description of blood absorption and inflammatory cell debris with the smallest order was in the postmortem wound when compared to the antemortem and perimortem wound. Histological findings in the study revealed features of mild bleeding and mild inflammatory cell debris in postmortem wound. As we can see in the both pictures on the slide, the first one is mild bleeding on postmortem group, and the second one is mild inflammatory cell debris in postmortem group. That's all from me, and thank you.
Hello, my name is Tigista Ayuka Franipanipadanti with the three last digit on my student identification number is 064. Today I'd like to tell you about the clinical methods used in the identification of intravital wound. Understanding the relationship between the wound and mortality frequently depends on knowing whether the lesion was generated in life, or we can usually say as an antemortem lesion or postmortem lesion, as well as how much time had gone between the lesion formation and the death. Antemortem reactions such as hemorrhage, inflammatory cell infiltration, and also creation of granulation tissue are considered as antemortem wound. Morphological and molecular biological approaches are utilized to assess wound virality. The combination of those parameters may reduce the mistakes of wound age estimation. The first one is morphological analysis. Visual inspection can use to assess the age of the bruise based on their coloration. The time of appearance and also color of bruise are affected by many things such as depth, position, and also the skin tone. The next one is immunohistochemistry, which is the gold standard to determine the antemortem lesion or postmortem lesion. It is very simple to use, doesn't require any expensive or specialized equipment, and also possible to assess unsolved cold cases. The next one is molecular biological analysis. mRNA-based assays is appropriate to assess the age of early-stage wound. The next one is Western blotting and enzyme-linked immunosorbent test is also can use to assess the age of the wound and also the protein levels. That's all from me. Thank you. Next.
My name is Putunida Kusandi Wirahadi with last three digit of student identification number is 028. I would like to explain about the practical appliance of identification of intravital wound. Identification of intravital wound has very important uses in the forensic medicine, one of which is in the investigation of causes of death. Practical appliance of the identification of intravital wound can be seen on fire cases, where investigation of death has several objectives, including the identification of victims. Another important goal is to establish whether the victim died during the fire or before the fire occurred to investigate the possibility of homicide being faked by a fire accident. The difference between antemortem and postmortem burns is that in antemortem burns, there are intravital signs in the bulla and vesicles, while in postmortem burns, there are no such marks. Another difference will be seen in the presence of soot in the airways of antemortem burns and carbon monoxide saturation above 10% in the blood, whereas in postmortem burns, it is not. That's all from me. Thank you.
Thank you. My name is Puturati Padmardigantarisari with the student ID number is 200251177. I will continue the presentations and I will explain the differences between antemortem burns and postmortem burns. The first one, in vesicle or bulla point of view, the antemortem burns have the hyperemic color on its surrounding. The fluid contains a lot of albumin. There is an inflammation on the base of the vesicle and there is no air at the base of the bulla. But in postmortem burns, the surrounding color is not hyperemic, fluid does not contain albumin, the base of the vesicle is dry and hard, and there is air in the bulla. And in lung point of view, the antemortem burns, there is soot and there is an inflammatory reaction in the epithelium of the respiratory tract. But in postmortem burns, there is no soot and no inflammatory reaction in the epithelium of the respiratory tract. The last one, in microscopic appearance point of view, the antemortem burns contains polymorphonuclear cells, but in postmortem burns, there is little or no polymorphonuclear cell. That's all from me. The presentations will be continued, my friend. Thank you.
Hello everyone, my name is Victoria Kadampeoga and my student identification number is 200251184. In this opportunity, I would like to give summary about determining intravital wound sign. Intravital wounds are traumas that occur while a person is alive or before death. There are several methods for determining intravital wounds, such as macroscopic, microscopic, radiological, and biochemical methods. On macroscopic, we can find bruises, petechia, bleeding, tissue retraction, vesicle, bulla, or erythema. On microscopic, we can find polymorphonuclear leukocytes infiltration, fibrin accumulation, and bleeding. On biochemistry, there is an increase of histamine, serotonin, lactate, and carbon monoxide in the blood. The last is radiology. We can find embolism or pneumothorax. Personally, advanced methods have been developed, namely immunohistochemistry and molecular biology. So there's our bibliographies we use. And that's all from us. Thank you for your attention. I hope this presentation has given us new insights on the determining intravital wound science. Thank you.